Yeah. Bethany Tailor. Good. So, case notes. D drive. Bethany Tailor. Bethany Tailor. Bethany Tailor. Medicine and nursing. Yeah. Yeah. Yes. Head floating. So, writing workshop. And now we have a letter of Sreeja Raveendran. Okay, everyone can learn from this session. Okay, right. So you're writing to nursing task is here. Discharge letter. Maria DiCoxio. Miss Maria DiCoxio, right? Proudest mental health home, right? 231 Brightfield Avenue, Proudest, right? Very good handwriting, excellent handwriting. Okay, but the thing is, don't touch the line above. Handwriting is good, but your letters, why this is dancing like Hrithik Roshan? Eh? Hrithik Roshan's dancer. He'll be bending like this, like this, like that, this letter. Why this letter is bending so much? Does a letter H look like that? Do you need me to show how H looks like? This is what is H. Okay, do you want me to teach you how to write H? Sreeja Raveendran, I know your answer is, I know your answer. It's okay. Not only you, there are many people who write like this. Just your letter, I'm taking an example to tell everyone. Okay. This is the letter, how you have to write. 1 second, please. Hello. 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 Sorry. Sorry for that. Yeah, H. And this M, is this M? Why this design? M. M is like this. Okay. M, you are supposed to write like this. Don't touch the line above. And O, is this looking like D? No, that is not D. D is like this. This is a D. You have written O. And why it is touching this line above? Write very clearly, please. Is this looking like B? Why this B is a dancing? Going like C? Why can't you write straight a B? Huh? Why? This is B. What is the difference between this B and this B? Can't you notice? It should not touch the line, number one. It should not be circular like this. Okay, and both the letters should be approximately same height. Upper one will be little smaller, that okay, no problem. Okay, and here there will be curved, right? So this is how you are going to do. That's very clear, right? So 18 March 2000, your handwriting is very beautiful, no doubt regarding, but the shape is lost. The shape of the letters, the shapes of the letters are lost. Very beautiful handwriting. When you look at it, it's very good, beautiful. Okay, but individual letters, you have spoiled the shape. Dear Miss Maria, comma should be immediately. Regarding Miss Bethany Tailor, aged 35. Okay, that's good. Miss Tailor, who has been recovering from decompensated schizophrenia, comma, requires ongoing care and appropriate management following the discharge. Following the discharge. Following the discharge into your facility. Discharge to your facility. Charge into your facility today. Okay. On 1 March 2018, Mr. Tailor presented with symptoms suggestive of decompensated schizophrenia. Already you mentioned decompensated schizophrenia. Okay. Already you mentioned above. So no need to mention again here. No, no need to mention here. Then you could have said there. No? Such as altered thought process presented with the symptoms. Remove that suggestive of decompensated schizophrenia. Symptoms. That's enough. Of decompensated schizophrenia, remove. Okay. Symptoms. On 1 March 2018, okay. Upon admission on 1 March 2018, upon admission on 1 March 2018, remove Miss Tailor. Remove presented with symptoms suggestive of. Upon admission on 1 March 2018, altered thought process, not such as, they only, not such as, not similar to. These are the symptoms, not symptoms such as. Such as means likewise, like. It's not like, it is altered thought process. So you cannot say such as. They are the symptoms. Okay, right? Not like, it's they themselves. He looks like my brother or he is my brother. See the difference. He is my brother means my brother itself. He looks like my brother means he is not my brother, but he looks like. So such as is same thing look like. So you cannot. You can take the same sentence. Such as means similar to, but not they. So such as wrong here. Upon admission on 1 March 2018, comma, altered thought process, visual as well as auditory. Auditory. What is the spelling of auditory? Huh? Tary or Tory? Huh? Is this look? Does this look like A or O? I don't know. You have to tell me. Auditory. Tary. It looks like A. The tail is seen here. The tail is seen there. Same like here. Hallucination. Why this gap on the top? You want to pour water into the cup or what? Huh? Tell me. A. Is why it is in the top on the gap? Is it you? Like this? This is you understood. But A, why are you not closing that? Why are you opening the mouth? Huh? Okay, be careful. Be careful. I'm telling you, I'm not criticizing you negatively. It is constructive criticism. It is constructive criticism. That's it. Auditory hallucination or hallucinations. Okay. Auditory and visual. Hallucinations. Hallucinations. Okay. Hallucinations. Fine. Auditory and visual hallucinations. And delusions. And delusions. Aggressive behaviors. Agitation. Behaviors. Aggressive behaviors. Aggressive behavior. Agitation. And medication non-compliance. Why this messing up here? What is this? Non-compliance. Where is hyphen? I don't know what it is here. Why here? Till here it went. Why are you writing in the right margin? Is there no space below? See, this much space is left. You could have written down, no? Medication non-compliance. Entirely you could have taken down. What is the problem? Were noticed. Very good. During hospitalization, don't touch the line above. Don't touch the line above. During hospitalization, antipsychotic medication was recommenced along with behavioral therapies. Satisfactory response to the managements were demonstrated. Response, SE, not a DS. Response is a verb, response is a noun. Okay. Satisfactory response, RESPONSE. Satisfactory response, SE, to the managements. Response was demonstrated. See, you wrote a response, so that's why you made a mistake here. Not were, was demonstrated. Response was demonstrated. As evidenced by cessation, no, cessation. Write 10 times these spelling mistakes. If you are angry with me, no problem. You are my student. You are my child. No problem. You are angry. All the children are angry with parents. No problem. Write 10 times. Okay. This many mistakes means definitely you must write 10 times. Where is this girl? Sreeja Raveendran. Hello, Sreeja. Unmute.
Yes, sir. Yes, sir.
You are supposed to write each word 10 times and send me as a proof. Otherwise, I will not correct your
Okay.
next letter. Okay.
Okay, sir.
Fine. Cessation of hallucinations. Comma. Organize. Why comma before comma space? Is this much space needed before comma? Organized thought process. Organized thought processing. Okay, organized thought process. Processing is better. And does this look like N? I think it looks for me as U. It looks like me as U. How far you have to go from here? How many kilometers from here? Huh? 45 kilometers. 25 kilometers. Go home. Then number one, name how many sessions. Number one, name OET number of sessions. Number two, name IELTS number of sessions. Make a list and send it to me. Let us standardize for your own good. Okay. And if any students are attending in the evening, If they're calling you, if they're interested, you can take extra sessions because you have finished 48. These are overtime for you. You can do it. You understand? No problem. If you are comfortable, it's not compulsory. There are some students who don't give importance to us. If it is genuinely okay, then give. Okay. Somebody is sick in the hospital, or somebody is serious, somebody has some serious problems, then you give. Otherwise, no need to give. You just message me, I'll follow it up. Okay. If the condition is genuine, we'll give it. Morning to 8 to evening 6 o'clock, you are waiting there and I am waiting here. We are beggars like come, come, come. They'll not come. For such people, don't give. If the condition is genuine, I will tell you, then take. Those will be considered as overtime. Right? You just message me, sir, this candidate is asking me to take. Can I take? Or some students are really serious and you believe them that they are regular and attending every day. Such students, you can take sessions and then afterwards inform me, because you trust them that they are really regular, not irregular students. Don't give irregular students, please, because they should respect us. No, we are waiting from so long. I'm an old man, I'm waiting for so long. Correct? Huh? Done. Go. Love you. Yeah. Organize thought process and focus on activities of daily living. It would be appreciated if you could ensure medication compliance to prevent further decompensation. Wonderful sentence, no mistake at all. But a T, this T is not very clear. It looks like L for me, without line is not clear. Okay, write very clearly. Why is it bending like Hrithik Roshan's dance? Eh? Hrithik Roshan's dance? Yeah. It would be appreciated if you could ensure. Okay, ensure this N is okay, little bit, but it is pointed. It should be U cup shaped. Exactly. In medication compliance to prevent further decompensation. It is vital to monitor regularly for objective signs of psychosis and deviate from delusions. Deviation from deviation. Monitor for deviation from delusional thoughts. It is crucial to continue behavioral therapy to maintain behavioral control. Wonderful. Kindly note that risperidone 1 mg twice daily can be given for agitation or psychosis in addition to regular dose, the regular dose. In addition to the regular is one particular, the regular dose of 4 mg at night. In case of any additional, in case, comma, in case, comma, of is not required. In case, comma, any additional information is deemed extremely relevant, please do not two separate words. Why did you write them together? Do not are two separate words. Do not hesitate to contact me. Yours sincerely, right? Put a comma here. Put a comma here. Yours sincerely. Charge nurse, right? Charge nurse. Yeah. Using the information and write a letter receiving nurse long term following discharge. Uh, discharge. Yeah, fine. So that's good. You're writing well. Your handwriting is beautiful, but not font is not properly maintained. That you can see. Okay, that you can see. Right? Little reduce the font, capital letters, I mean, and the letters going up above the line. Okay, so that it will be beautiful, impressive handwriting. This is V. V is looking like U. V should be pointed. Okay, I'll show you the difference between you and we. This is you and this is we. What I should tell you? Huh? Is this looking like H? This is also looking like you or we. I don't know. Okay. Is this looking like H? I'll show you H, how you have to write. I'm sorry if you're angry, but I have to tell you, you're paying 35,000 for the exam fees. Okay, this will be considered a spelling mistake if they don't understand. They'll not give you mark. Many students, because of handwriting, they're losing their marks. Switch off the AC, no? Feeling cold. If you want, put on this fan. Feeling cold. I'm old man, no? Right. Yeah. So Kiran, good evening. Kiran, did you do speaking sessions? Okay, I think you have done. Okay, you have registered, no? You have done. So all the students, doctors, nurses, anybody, you can ask for me. I will give you the slot. Yeah, very good. Kiran, your number is a 6 first. Yeah, number 6, Kiran Kaur. Number 6, Kiran Kaur. Your letter will be corrected in the 6th order. Now this is second letter going on. Next is Kavar Ali. Kavar Ali, be ready. 2 minutes. Kavar Ali is there or fed up and went off? Yeah, Kavar Ali is there. Very obedient, I know. Dr. Kavar Ali from Pakistan, unmute. Okay, no problem. Be ready. Yeah,
Yes,
Kavar
sir.
Ali, be ready. Next is your turn. Maybe in 3 minutes we are going to start. After the feedback from this girl, we are going to start. Be ready. Yeah. So Sreeja Raveendran.
Yes, sir.
Yeah, do you have any doubts or anything? You let me know.
Okay, sir. Thank you very
Suggestions.
much for your valuable correction, sir.
Why? What valuable? I'm only shouting at you. You should be angry with me.
No, no,
Correct?
it's okay.
Uh,
Because of you only, I am improving.
because of me, you are improving, but I should not shout at you
My
like this. No,
style
I
has
cannot. I
improved.
cannot treat you like LKG student, right? Writing 10 times
No, no,
imposition. What is this
you
nonsense? What you are thinking?
are my
What you are
teacher.
think? What you are thinking, sir? I'm an LKG student. You useless fellow, Mr.
No,
Simon
no,
Peter.
you
You
are my
asked me to
teacher,
write.
sir.
You are asking me to write 10 times. What in the world you are thinking about yourself? Correct? No. Number one. Okay. Write the spelling mistakes 10 times each, so that never in your life you will
Okay,
do these mistakes. Write the spelling mistakes 10 times. Okay. Imposition.
sure, sir.
Because I don't want you to write such mistakes again. Okay. Imposition. Sorry. The next one. Number 2. Suggestion number 2. Suggestion number 2. Most of your letters are confusing. Let them stop dancing your letters. Most of your letters are confusing. I don't understand the difference. Confusing. Okay.
Sir,
Maintain
my
clarity.
very bad
Now you
idea.
mute. You mute now. You mute. You mute. Just listen now. Maintain clarity. You will have to listen. You will listen. I know that. Now mute because I'm focusing on what your mistakes are. Don't touch the line above. Okay. Don't touch the line above. Okay. Don't write in the right margin. Left margin you are maintaining perfectly. But right margin, maintain the right margin also. Why are you writing after this one? You are not supposed to write here. Na? You are not supposed to write here after this line. See, you should stop here only. Why are this is called right margin? Margin means border. Why are you writing in the border? So if the paper is finished, you will write on the table also or what? Write on the table also. We'll parcel the table for correction. Be careful. I'll talk like this only. It may be funny, but it's not funny, my dear. It's very important. You are very important. That's why I'm telling you all these things. I can't accept. Number 3. Number 3. Maintain the right margin properly. Do not write in the white space. Number 4. Number 4. I don't have any problem with your presentation. Presentation is excellent. Yeah. Sorry. Following the discharge facility today. Okay. Yeah, that's fine. Mostly fine. Okay, next one is fourth one. Please type this letter and send me within 12 hours. Okay, because there is something benefit for you. Number 5, submit one letter every day without a fail and without any request from me. It must be sent. And get one letter corrected like this every day. I want you to. Okay. I want you to get your letter corrected. Fine. Otherwise, everything is fine. Okay. Why my throat is thirsty? No water here. Okay, please. Okay, no problem. I'll get it after some time. Otherwise. Anyhow, I'll take in one after this letter. I'll take a 2 minutes break. No? Then I will take. Yeah, fine. File, save as. Yeah. Manuscript, feedback. Yeah. So next is cover Ali's letter. So you can take from here, okay? All your letters will be in Telegram. All your letters will be in Telegram. You can take from there. Yeah. Next letter is OET. Simon says OET. Here. Nursing writing reviews. 5974. What's the name of this girl? Sreeja, Raveendran, Bethany Tailor. 1 sorry, 1 Control C. No, okay. Control C. This and this. Go here. Yeah, paste here. Yes, feedback. Yes, Sreeja Raveendran, your number is 5974. Just go to the Telegram and type your number 5974. Just to type there 5974 and your letters will come here. Okay, 5974. You can see there. Oh, I would have to paste here. But okay, no problem. You can see here. That's it. So directly only your letter will come 5974. Whatever number I give, you can take there. Okay, bye. You're already given feedback, so no mic opening. Yes, next is Cover Ali. Cover Ali, excuse me for 2 minutes. I'll just have some water and then prepare some tea. Is that okay, Cover? Cover is very generous. I know he will give me time. He will not say no. Yeah. Cover is very patient. After Cover is a Simiat. Be ready, Simiat. Yeah. Yeah, thank you, Cover. Thank you very much. So kind of you. Cover Ali. Cover Ali letter. Which letter is that? Name of the letter, please. Cover Ali. Name of your letter. Shaukat. Khan Shaukat. I don't know. 2 second name. I don't know how I shaved your name with Kanshoghat. Okay. Giovanni Decoxio, same letter. Bethany Taylor. It's not Giovanni Decoxio, it is Bethany Taylor. Same letter actually. Yeah. This is Hipsa Jailani. Yeah, Bethany Taylor. Yeah. Where is your handwriting letter of this? Bethany Taylor. This is Sally McConville. Your handwriting improved. Cover very nice. Nice. Your handwriting improved. But where is this handwritten letter? Huh? Where is the handwritten letter of Bethany Taylor? Okay. Oh. Sorry. Bethany Taylor. Bethany Taylor handwritten letter is not there. So okay. I'll take this letter, not Bethany letter. Yeah. Because he was there, no sound disturbance. And we can shout. Any Indian doctors are there here? Indian medicine, ear cleaning. We have to get medicine, ear drops, wax removal, melting and cup, something like that. Or we'll go to ENT specialist and clear it. No, you can go and get that one. Okay. Check how many copies are there. Okay. That, yeah. Not there. Wait. So this is finished. So we have got these two letters. These fellows. Korean. Okay. So this is gone. Right. Downwards. X. E drive. Medicine writing reviews. 1370. 1346. New folder. 1346. Cover. Okay. Yeah. Sally McConville. Is this corrected cover? Sally McConville. Is this letter corrected? Sally McConville. Yeah. I'm taking this letter. If it is corrected or not, tell me. Corrected or not. This is a medicine letter. Yes, cover. Can you type in the chat box? Hello, cover.
Yes, sir.
Letter corrected or not corrected?
Sir, my letter was not. I have sent you,
This one, this
but
Sally McConville, is it corrected or not?
not corrected. By
Yeah, that's what I'm asking. Okay, fine. I'm correcting. Yeah. So, yeah. Admitting officer, emergency department, Newtown Hospital. Newtown, not Newton. Newtown. Town. Town. Remember that. That is the spelling. Newtown. Newtown. Newtown Hospital. That's the correct spelling. 13 September 2014. Your handwriting improved a lot. Okay. Earlier, your handwriting was not very legible or readable, but now it is improved a lot. I can say I really appreciate you. Regarding Miss Sally McConville, comma, aged. A should be small letter. No need colon. No need colon. And no need capital letter. It should be small letter. A. Aged. 38. Dear officer. No, admitting officer is a doctor. So, dear doctor. It should be dear doctor. Dear doctor, I am writing to refer Miss McConville, whose signs and symptoms are suggestive of acute asthma, probably due to pneumonia. Okay. What is the purpose? There is no purpose. There is no purpose. You did not write purpose. Why are you referring? That you did not write. Eh? Why are you referring? I am writing to refer Miss McConville. Why? Why are you referring? Signs and symptoms are suggestive of acute asthma. Maybe because of pneumonia. That is fine. But why? What do you want the other person, doctor, admitting officer, do? What do you want him to do? That's more important. So Sally McConville. Yeah. What is the purpose? It's an emergency letter. It's an emergency letter. Where is that emergency? Huh? For urgent assessment of asthma. That you should write. Huh? So, possibly because of pneumonia. Okay. Acute asthma, possibly because of pneumonia. Now, why? For what? For acute management and investigation. Okay. For acute management and investigation. Why you did not write these two? Refer to emergency department for acute management and investigation. So there are three things which you missed. Number one is emergency. Number one you missed. Number two, acute management you missed. Number three, investigation you missed. So I am referring for what? For immediate assessment or urgent assessment. For urgent assessment. Okay, urgent letter. No? Huh? Or urgent management. Investigation means assessment. Huh? For emergency is already there. For urgent, change it to urgent. Urgent for immediate assessment. Immediate assessment or immediate assessment, comma, further investigation and appropriate management. This you could have written. These three things you have missed here. Yeah. You have missed these three things here. I am writing to refer Miss McConville, whose signs and symptoms are suggestive of acute asthma, probably due to pneumonia. Okay, he requires immediate assessment, that means emergency letter. Further investigation and appropriate management. Where is this one? This you missed, no? Okay. Right. Miss McConville developed more shortness of breath. Okay. And feverish-like feeling. Feverish-like feeling. What do you mean by feverish-like feeling? In spite, two words, not one word, in spite of using antibiotic prednisolone today. In spite of using, in spite of using, in spite of using in spite of using antibiotic and prednisolone today. On her clinical examination, the signs of respiratory distress, the signs of respiratory distress were present in the form of increased respiratory rate. We can put in brackets. Use of the accessory muscle. What is this? Increased work of breathing, widespread of wheezing, and bilateral crepitations. She was treated with salbutamol. The condition was treated. Why the condition was managed with salbutamol nebulization. Okay, that's better. She don't try it. She too many times. Okay, she was correct sentence correct, but quality low. He no need. She was treated with salbutamol nebulization. Although no improvement was seen after 15 minutes on her respiratory disease. She was treated with salbutamol nebulization. However, no improvement was seen after 15 minutes. Okay. However is better. Although is not suitable here. You can say however better. Yeah. No improvement was seen after 5 minutes, 15 minutes on a respiratory disease. Initially, on 10 September 2014, Ms. McConville presented with the complaints of the is not needed. Already you told the here. The complaints of runny nose, productive cough, mild fever, and wheezing. A nasal and wheezing. And change it to wheezing. Wheezing. You can change it to wheezing. A nasal and throat were congested. Nasal is an adjective. Nasal were congested. Her nasal was congested. Her nose and throat were congested. Not nasal. Okay, she had nasal congestion. Nasal and throat congestion were noticed on clinical examination. Like that you can. Nasal and throat congestion. That's fine. Nasal. No need her every time. Nasal and throat congestion were noticed on clinical examinations. So on clinical examination, nasal and throat congestion were noticed, were observed. Okay. She was treated as the viral upper respiratory tract infection. Viral upper respiratory tract infection was diagnosed and treatment was provided. Viral upper respiratory tract infection and infective exacerbation of asthma were diagnosed and therefore relevant treatment has been provided. On the subsequent visit, so here you can write she was treated for viral upper respiratory tract infection. She was treated for, not as. So this is confusing. Okay. As is not right. She was treated for. No need the. She was treated for viral upper respiratory tract infection and infective exacerbation of asthma. So here you can write for. She was treated for, but she is not good. Just to start from viral upper respiratory tract infection and infective were diagnosed and relevant treatment was provided. Like that you can, that is better. And next, on the subsequent visit, during the subsequent visit on 12 September, better not in the subsequent, during the subsequent visit is better. Okay. During the subsequent visit on September 12, comma, 2014. We know it is 2014 only, no? 2014 only. So no need to write year again if it is the same year. If it is the same year, no need to write the year. Miss McConville reported shortness of breath on minimal exertion and wheezy chest was present. Widespread wheeze was present. Okay. Reported. Was present is not needed. You already said here, stated. Then was present is not needed. She was treated. Thank you, Bethany. She was treated. She was treated for infective exacerbation of asthma. For, not as. She was treated as, not fine. She was treated for. Treatment was given for. She was treated. Treatment was provided for. Is better. She removed. And medication was given as. Medication was given as. Medication was given as. Why medication was given as? Why? Directly tell the name, no? And amoxicillin 500 milligrams. mg, enough. Right, mg. mg, enough. Thrice a day, thrice daily, once a day, once daily, for 3 days. Have been given, have been prescribed, have been administered, have been prescribed, or have been given, have been provided, have been administered, or have been given, or treated, or provided, or prescribed. You have been given in your own words. Okay. Ms. McConville is a known case of asthma, hypertension, and depression. Your word length is too much. Reduce your word length. Ms. McConville is a known case of asthma, hypertension, and depression. Therefore, she was taking. Therefore, okay. She was taking Ramipril. Why R capital letter? Ramipril is a brand name? No. Ramipril is not brand name, generic name. Ramipril. Pinapril. Wait. Ramipril. Ramipril. Brand or generic name. So, Ramipril. Altes is brand name. Altes is brand name. Okay, Ramipril generic name. Okay, general name is Altes. Okay, brand name is Altes. Ramipril is generic name. Okay, Ramipril is generic name. Brand name is Altes. That is it. Okay. So why did you put a capital letter there? Okay. What 2.5 milligrams mg. No need full. Once a CE clear. Once a day, inhaler fruitic acid. Inhaler of fruitic acid 250. 250 watt. 250 watt here. number, milligram or whatever, anything is there. Fluticasone. Fluticasone. 250, 2 puffs daily. Okay. 2 puffs daily and inhale it, salbutamol. 2 puffs if needed. Okay. In light of the above, your further care. Your is not necessary. Further care related to Miss McConville's condition would be beneficial to improve her health. To improve her health condition. To improve. Something is missing here. To improve. Why so much gap in between? There's so much gap. Here, in case, comma, no need of. In case, comma, any additional information is deemed extremely relevant, please do not hesitate to contact me. Yours faithfully, admitting officer. Yours faithfully, comma. Put a comma here. Doctor. Yeah. So that's good. Yeah, that's okay. That's okay. Ramapril is not a brand name cover. I have shown you Ramapril is generic name. Brand name is Altes. Okay, fine. You have said sorry. Okay, no need to say sorry. Okay, no need to say sorry. You're just learning. So no need to say sorry. Right. I'm giving you unmuting power. You can unmute. I hope you understood the letter. Another letter also I'll correct afterwards. I'll call you. Once I correct the other three people's letters, then I'll correct afterwards. Today I'm correcting letters only. Yeah. Maybe in between I'll take one session. Then afterwards again I'll correct the letters. So be available. Cover Ali, unmute. Cover Ali, unmute. I'm not able to unmute or what? Okay. Okay, fine. Yeah. File, save as, medicine case notes. Yeah. Okay. 1346. 1346. Miss Mrs. Sally McConnell. Sally McConnell. Okay. Sally McConnell. What McConnell? I don't remember. Okay. What's the name of this? Dr. Kavarali. Yeah. Acute asthma. Acute asthma. Kavarali. Manuscript. Patent. Yeah. Yeah, I'm sending this letter to the Telegram channel. I tried to contact you, but you are not able to unmute, so no problem. You can message me personally. So let's invite you. Yeah, I've given you there. Your handwriting has improved a lot. Definitely, I can tell you. Your handwriting improved a lot. So, yeah, I've sent the feedback already. And another letter also I'll correct tonight. Okay, next letter. So those whose letters are there pending can message me. So the next letter is of, yeah, here are they. Here, fourth one is Simiat. Control C, Simiat. The next one is Ipsa. Next one is Kiran Kaur. Yeah. These are the three letters correcting. Anybody has letters, you can. Rajeshwari, your letter is there, you let me know. Josephine, your letter is there, you let me know. Okay, this is how we are going to correct the letters. Let me have a little bit of break. Then I'll send you the link again. I'll just have some tea and I'll get back to you. Okay. Same link. Same link. Say 10 minutes. 10 minutes. Okay. Or you can stay online, no problem. I'm not closing the